I've had a facelift.
Can you look young for most of your life?
So were you thinking about a little?
I'm going to at some point. Look how good that looks.
So, what are we doing today?
Today we're going to talk about a very, very important question. When am I ready to have a facelift? And I'm going to give you 5 indications that you're going to use to guide that decision, because honestly, literally every day, in one way or another, whether it's Instagram comments, YouTube comments, in my consultations, which I've done literally thousands over the last 20 years, I get asked this very question. I think I have a good idea of how to really put it into a framework that's going to allow you to determine for yourself whether or not you are indeed a candidate for a facelift. It's a big decision, but an incredibly rewarding one. And if you do it with the right parameters in place for the right reasons and the right indications, you'll definitely not regret it. If you do it wrong, it could be one of the most regrettable events of your life. Because it's your face, you don't want to get it wrong. Hopefully after this video, you are going to know exactly how to determine whether or not you are ready for a facelift. Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. One of the most powerful tools in the facial rejuvenation toolbox to help people look as young as they feel is a facelift. And in my practice, I do a trademark procedure that I developed called the vertical restore. So sometimes I'll use those terms interchangeably, but just know that everything that I talk about related to my practice is vertical restore. But for general purposes, I'm gonna speak to it in the term of a facelift. Before we launch into the 5 criteria that you should meet before you realize that you're a candidate for a facelift, I'm gonna spend a few moments just putting things into perspective for you. No one needs a facelift, right? Fortunately, this is a completely elective procedure and one that brings tremendous amount of positivity and joy when done for the right indications and reasons. And as a result, it's not something that needs to be rushed, and it's also not something that needs to be done for arbitrary reasons. Like, for example, some people think that just because they're at a certain age that they should get a facelift. Some people think that they needed to wait until everyone around them supports the decision that they are a candidate for a facelift and they should go forward. Interestingly, my wife, who I performed her facelift, her, in this case, a vertical restore, roughly about 6 months ago, we had her entire journey on a video here, which you should check out after. She had a very interesting experience with this. So she's a doctor herself. And when she turned around 50, she kind of, started seeing a little bit of changes happening. And by the time she was a little bit older, around 52, those changes became significant enough that bothered her. Now, the changes were not significant in the eyes of her friends and her community. And in fact, her sharing the experience with them made her feel worse about it, because it continuously made her feel maybe she's jumping the gun, and it basically brought doubt into the decision. And fortunately, she shut that off and did what she wanted to do, which is the point that I'm making here, is it's a highly personal decision and it needs to come from you and only you. It doesn't matter what your spouses think and your children think and your friends think. If you feel this is something that you want, then it's worth exploring. And there should not be any other reason to go forward with that except for that interpersonal thing. And in my wife's case, when she finally shut out that noise, and all of her friends are obviously well-intentioned and meant nothing but to support her in their opinion about the decision, she was so happy when she finally did the procedure. And now, 6 months later, she's a much more confident, hopeful, aligned person, which I'm going to share a little bit what that means in a little bit. But she's beyond happy she did, just like truly the thousands of patients that I've treated over the last 20 years. It's one of the most rewarding and positive life events for people when it's done in the right reasons. But sometimes from your point of view, it's hard to know when is the right time. So make sure you share this with some friends and family. If you haven't already, make sure you subscribe to this channel so you can get more content like this. But without further ado, let's break it down. So number 1 is age. You would be shocked. We literally get thousands of inquiries through our website for patients interested in vertical restore every single month. We have to weed through this, and you would be shocked at how many 25, 30-year-old people think that they need a facelift. It's rarely the case. It doesn't mean that it's never the case, because there are cases of premature aging. But if we want to talk about age as just a general guideline, it ties very, very closely to perimenopause and menopause for women. I've spent some time talking about this in a video as well. This seems to be tied very closely to estrogen levels. So when estrogen levels drop, the facial fascia, which essentially holds the face up and into that youthful shape, begins to loosen, and the face starts to have changes. So typically, this happens in the late 40s and early 50s for most people. So if you're above the age of 45, you're kind of in that range where you probably are the right age to consider. Now, let me also back up for a second and say 20 years ago, I think it was very, very uncommon, even 15 years ago, uncommon for somebody in their early 50s to do a facelift. Today, not only in my practice, but almost every practice of my colleagues that we share discussions on, the average age is early 50s, late 40s for doing these procedures. And that doesn't mean that if you're older and watching this, that you're not a candidate, but people are taking a more proactive approach towards facial rejuvenation. And what that means is instead of waiting until everything has fallen, you've got this like very obvious, you literally could tell from across the street that this person would benefit from a facelift, and there's no friends or anyone gonna stand in your way kind of a situation. We were doing it much older. 60, 65 was the average age for people. But that meant that they were living for about 10 to 15 years not loving what their face is doing, because once the onset of aging starts, it really starts gaining speed year after year. So there's a big difference between what a 60-something-year-old looks like and what somebody in their early 50s looks like, right? Huge difference. A lot of aging happens in that decade. And what people want to do is early intervention to prevent that from happening. I'm personally a huge fan of that. In my opinion, that's one of the most sophisticated ways of addressing the problem, because number one, if it's bugging you, why not scratch that itch and be done with it, so to speak, right? So I think that's a big reason. Secondly, it makes it easier to regain what is fundamentally a younger version of you if you don't allow your face to fully age and stay aged, which kind of remodels the face when it's held on for like a decade or decade and a half. It makes it harder to look like a 30-something-year-old or somebody who's in their early 40s. So early intervention has the benefit of psychological impact, but also physical. And I'm a big fan of it. But again, people of all ages, when I say all, I'm talking about older ages, will have an unbelievably rewarding and exciting outcome, as we've seen with many of the patients that we've shared here on this YouTube channel, I share on my Instagram. And then we have the younger patients who are, again, prematurely aging, which my heart even goes out to, honestly, even more, because if you're in your late 30s or early 40s and you've got jowls and neck laxity, well, you don't really feel confident and beautiful and young at that age when everyone basically deserves to feel that way because everyone else is feeling that way. So we'll still apply the procedure. So age is looked at this way. Number two, you no longer look as young as you feel. In my opinion, this is sort of the entire story, the motivation. And I'm 51 now. In my mind, I swear, I think of myself as like somebody who's in their early 30s, maybe even sometimes late 20s. Like I have a hard time if I get a glimpse of myself on these videos, which I hardly ever watch after I film, but I see the gray hair. It's not consistent with who I see myself like on the inside. This is the reason why most people want to get work done in the first place. And it's not just they want to get a facelift. This is the reason why they do Botox, they do fillers, they do all these non-invasive treatments and threads and all this other stuff, is because they're starting to see there's a gap forming between how young they feel and how young they look. And that gap, as it widens, it becomes more emotionally problematic, that discordance, that disconnect between the two. So I've discovered very early that this is what this whole thing is about. This whole category of facial rejuvenation, and me as a surgeon, as a doctor, what I'm really trying to solve for people is bringing that connection back, that alignment back between the two. And a little simple experiment for you, if you're a little bit older, late 40s, early 50s or whatever, you'll be able to relate to this exercise, but literally just close your eyes for a moment. Just close your eyes and answer the question, how old do you feel? Chances are you're going to say you're in your 30s somewhere. And the reality is you're going to be in your 50s. And what's interesting is even like a 60-year-old can feel like they're in their 30s, so the gap just widens as time goes on. But that is assuming that you're actually healthy and take really good care of yourself. And if you do, then you actually feel young and therefore you look young. So this is another, I'm just going to explain this point here for a moment. As we're trying to reverse this aging process and help you become a younger version, close that gap, basically, that, help you look as young as you feel with facial rejuvenation surgery, vertical restore, facelift, etc. The one super, super important part of this whole thing is that your skin actually looks young as well. Surgery affects shape, but what makes a person look young and what makes you look as young as you feel is a combination of the things that make a young person actually look young, which is young shape and young skin. Think about what a 20-something-year-old, 30-year-old looks like. They always have nice-looking skin. It's supple, it's clear, there's hardly any pigmentation on it, there's no fine lines and wrinkle, and they've got a firm jawline and neck. That's a young person. That's who you envision yourself as. The surgical component we can address through facelift. The skin component you have to actually take care of. I've done lots of videos, and I literally developed the KaramMD trifecta to basically make that process of anti-aging skin and making skin performing and looking young easy and effective and simple enough for people can do it consistently for that very reason, because you can't have one without the other. So that's really, really important. I want to emphasize that right there. Number 3, when there is enough soft tissue to move. So let me explain this for a second. When you ask somebody, what do you want to look like after this type of surgery? And I'm sure if you're in this category, this is going to sound super familiar. You literally say, oh, I just want this. I look at myself in the mirror however many times a day, and it's becoming more and more common that I do this. I lift up, and sure enough, my face looks more youthful. Because what aging is it brings all of this down. And what facial rejuvenation is, through the use of a vertical restore facelift, not all facelifts, but vertical restore specifically, is to bring this all back up, this direction. That's the natural vector of facial rejuvenation. Just in case you're a little confused about what I just said there, a lot of facelifts don't bring the entire face back up completely. That's one of the beautiful things about the vertical restore, is how comprehensive it brings all this up. So I'm used to speaking about it in this way, but I recognize that not all facelifts are created equally in this way. But the bottom line is, for you as an individual, if you find yourself doing this in the mirror and liking what you see, well, there's a good chance you're a candidate for it, because that look looks more familiar to you than what it does when it's all kind of down, right? And the more you wait, the more square the jawline becomes. Eventually, the neck starts to sag, the midface comes down. All this starts to get really heavy and square, whereas the youthful shape that you reproduce is one more of like a heart or a upside down triangle. We'd sometimes refer to it as a V-shaped jawline. That's the concept. And this was something that I found my wife doing literally all the time. Is she just started doing this much more and not liking taking pictures and this and that. I'm sure, again, these are all very relatable notions and concepts. So when that happens, that's a pretty good indication that you're getting there or you're already there. Number 4, and this probably requires a doctor, a surgeon in this case, a facial surgeon, to assess this for you, but there has to be actually enough soft tissue to justify the surgery. So what this means is, even though you may feel that you do this, yeah, it looks a little bit better, but is it enough to do the procedure? Now, this is where expertise, honesty, integrity as a doctor, and all that other stuff comes into play, because you don't want to operate on somebody who's not ready, meaning physically ready. So this is a physical assessment. I turn down patients literally all the time because they're not physically ready. They might have met those first 3 criteria, but if I don't feel that they're physically ready, we're not doing the procedure. So you have to have gels, and what gels are is where the soft tissue starts to hang over the jawline. Neck laxity is where you start to see things drooping down. Those are things that give indication that, yeah, we have a physical target, because the target of a facelift is gels, target of a neck lift is the neck. All of this coming up together is the idea, right? So you have to meet the final sort of physical criteria, which is you have enough to justify the procedure. If not, your surgeon might say, hey, come back in a year or 2, let's give it a little bit more time to basically, age, and then we'll do it. And I'm gonna side note for a second. This is where things get a little bit interesting, because when I tell a patient, hey, you're not ready for your facelift just yet, come back in a few years, a year, 5 years, 10 years, whatever the situation is. The default is the person wants to go off and start doing fillers, they want to do Morpheus, they want to do threads, they want to do whatever it is, right? Because we said that there's something that's bugging you we met these certain criteria, but you're just not physically ready yet. This is a massive mistake, a huge mistake, because first of all, those things don't work. At this point in time in 2024, 2025, those things don't work. We know this now. Putting a bunch of fillers in your face is just gonna make your face look big, heavy. So many people regret this. So many people are, you see celebrities, and I've done videos on this before, they're trying to remove the fillers. There's all these enzymes being used to remove fillers out of the face, etc. People regret the changes that occur because they're trying to hold off doing a facelift. Morpheus and all the other radiofrequency devices have been shown anecdotally and theoretically even that it can actually aid you because it melts away some very precious subcutaneous fat, all the while not making a difference in the way your face is sagging. Right? So fillers, risk, no reward. No matter how much filler you put in your face, it's not going to lift your jowls and your neck and all that other stuff. You might camouflage it, but you're not lifting it. And you're making it much more difficult for surgeon later on to do your procedure. Whatever other Sculptura, what other non-surgical procedures are there? I mean, there's any of these categories, no point in doing them. So when you're not physically ready, what do? Everyone wants to be proactive. I'm going to tell you what you do. You literally dig in and you just focus on your skin. And you wait. No harm in waiting, like we talked about earlier. There's literally nothing wrong with aging, right? Graceful aging, looking naturally aged is actually much, much better than looking bloated and filled with filler. And it's a lot better to age naturally and leave your tissue planes pristine for the next surgeon who's going to do this, as opposed to getting it in there and scarring it up with all these different things and losing valuable fat and doing all these procedures that ultimately actually end up costing you a lot more. And believe me, these costs add up. So when it comes time for you to be able to do your facelift, you're tapping into hard-earned money that could have been saved for the procedure down the road. I feel strongly about this, not because I'm a surgeon, because I can actually do every one of these procedures that I just mentioned. I could have all my PAs and nurses and have 5 offices around the country doing these procedures without me even having to lift a finger on them and make a lot of money doing it. But I'm being honest with you simply because that's my style, I guess, is I'm a doctor. I'm gonna be honest with you about what works and what doesn't. Those type of procedures do nothing. So better to just focus on your skin. And we put patients, for years, I've been putting them on skincare. Now it's trifecta, sun protection, maybe even some chemical peels and lasers just to make everything look a little bit better. For when the time comes, remember the skin and shape concept. You have young skin, young shape, you're gonna look amazing. So that's it. That's what you do when you're not physically ready. You just hold off and wait. Number 5, finding the right surgeon. This is an important criteria to get before you're ready. So you could be ready on all 4 of the things I just mentioned, but you can't go forward. I'm telling you this, you can't go forward until you feel 100% sure that you have the right surgeon. And if you don't, what do? You should know the answer to this now. What you do is you just focus on your skin and you just wait and do more research and find somebody that you feel comfortable with. Finding the right surgeon means that they meet your aesthetic desires. So patients who come to me for a vertical restore, and I get patients literally from all over the country and all over the world. And most of them have been literally researching for 2 or 3 years. They have the whole world to choose, right? So obviously they're gonna do their homework and research, etc. But they come to me because my outcome of creating a natural looking, significant facial rejuvenation, right? I mean, you see the before and afters. People look obviously 10, 15 years younger, but they don't look different. They don't look tweaked. They still have the essence of their appearance. They look young. And if you didn't know they had a vertical restore or whatever, you would literally never be able to tell that they've had any surgery done, both in terms of the look of their face, the animation, the way they smile, the incisions, the shape of the ear. There's no signs. So obviously I've honed my craft. This is all that I do. For 20 years, I've been tweaking and making things better and better and better. Patients who choose me because of that quality and because my outcomes are extremely consistent. So I'm just putting this out there for you to understand that not every facelift outcome looks the same way. So you have to match your aesthetic. And I have turned away patients in consultation. They're like, no, I really kind of want to look a little pulled. I want to look done a little bit. Well, you're not coming to the right person because I don't even know how to do that for you, right? So we pass on those. I mean, it's true, believe me, this, as weird as it sounds, but it's true. You need to find a surgeon that matches exactly the quality that you're looking for. And that means you have to keep researching until you do. So what are some of the criteria that you need to look for in a surgeon? So number 1, you want to make sure somebody is board certified, right? Board certified by the American Board of Facial Plastic and Reconstructive Surgery, board certified by the American Board of Plastic Surgery. You want to make sure they specialize in facial rejuvenation, that they have experience of doing these procedures in high volumes. Like I said, I mean, this is all that I do, and I do between 6 to 8 of these vertical restores every single week. That's high volume, right? That's a lot of them. A lot of experience is gained from volume. You also want to make sure, like I said, you want to look at the before and afters and see that they meet your satisfaction, your criteria. You want to look for opportunities for patient testimonials. You want to potentially ask to speak to some patients, etc. You want to do what you need to do to feel confident and feel that you can trust this surgeon. This is really, really important. Take your time, ask questions, do that. Once you have your consultation, you want to make sure the consultation experience feels right. It's a visceral thing. It feels right for you. You like the person, you're going to be interacting with them after surgery, before surgery, all that. You want to make sure everything met your expectations and you feel good about it. Can't stress this one enough. You need to have realistic expectations. Like, for example, the expectations that I give my patients are two. One is that we're going to have a significant improvement over where we started from. And number two, you're going to look totally natural. I don't promise perfection. I don't promise every line to go away. I don't promise, that your neck is going to be as tight as a mannequin's neck or that this is going to last forever. I mean, we're very clear, and any questions anyone asks me, I'm going to give it to them very straight. You want to also make sure expectations are met so that you're not disappointed after surgery. And then the next one is communication. You want to feel that there's a good communication with the office, that you feel like if you have questions or concerns. Now, not everyone needs a lot of communication, but if you're the person that needs a ton of hand-holding and needs to be talk to somebody every single day and talk to the doctor every single day, etc., that type of thing, then certain practices might not be right for you. So you want to make sure that you guys are aligned that way. And then finally is budget. You want to make sure that your budget is in line with what the surgeon, that you're seeking want, because everyone's got a different budget and every surgeon has a different price when it comes to these things, which now, I will just say part of this is also being mentally and financially ready for surgery. Now, this is a big one. So here's the deal. Surgery can be stressful. Surgery can, be taxing on the family and all this other stuff. You have to travel for it, potentially take a couple weeks to recover. So you have to be mentally kind of ready for all of that. You got to have your ducks in a row there. Financially, my honest advice is don't put yourself in a position where you're going to feel stressed by the decision to do surgery. In other words, you shouldn't be dipping into, your kids' college accounts or your retirement accounts or whatever the situation is to do this type of surgery, because in the end of the day, there might be guilt associated with the decision that you've done, the sacrifices that you've made, and now you put yourself in a position where you're going to be really hard on yourself and the outcome and the surgeon because of that. So financial readiness is honestly a very important aspect of it. This is elective. There's nothing wrong with normal aging. No one's going to die because they have jowls or neck laxity. Purely, really at the end of the day, a very luxury thing to do for yourself. And if you can do it, then you do it. If you can't, trust me on this, focus on your skin. You will feel so much confidence just coming from having lovely skin, a good skin palette, that it'll actually, sort of buy you time. A lot of patients who have lovely skin don't feel the urgency to have a procedure like this. And so skin is a very important aspect of it, and that's something that you can do. But I wouldn't, again, go and try, in this, especially if you're in a financial crunch, I wouldn't go do all these other non-invasive treatments that we mentioned above, because all you're doing is draining more financial reservoirs that can one day go to a surgeon that potentially will meet all the criteria we talked about, plus is within your budget. So that's really important. So in conclusion, my friends, I love what I do as a facial plastic surgeon who specializes in facial rejuvenation. Looking as young as you feel makes you even act younger, which is a beautiful thing if you're healthy and taking great care of yourself. So very rewarding. Just make sure that if you're questioning when to do this, you kind of think through these 5 criteria, and if it makes sense to you, then great, use them to guide you. And again, like I said earlier in the video, this is really important stuff and very valuable stuff. So share it with some friends and family. Let's get the word out. Let's help people understand this whole process a little bit better. And if you haven't already, make sure you subscribe to my channel. And truly, I think one of the best things that I can offer you guys is my free newsletter, KaramMD Journal. The link is below. Sign up for that because it gives you all sorts of information about skin tips and facial rejuvenation, do's and don'ts, etc. So that's a really wonderful thing to sign up for and get because at the end of the day, all of this is to help you be empowered and make good decisions. So if you enjoyed it, hit like, questions and comments, drop them below. And until next time, Dr. Amir Karam. Good chatting with you.